Welcome.
So, good morning, and I'm Dr. Sam, craniofacial surgeon and also the Deputy Medical Superintendent of Scudder Memorial Hospital. Now, it's a joy to be working here. I've been here for the last 17 plus years, and our hospital was started in 1866 by the Scudder missionaries who sacrificed their lives, their families, and they served the people of this region who were in a very backward state. They gave healthcare, education, and lifted the people out of poverty. And we are grateful to be continuing in that legacy, to continue the same mission in serving the needy people of this place.
All set? Okay, let's go. Sorry. Okay, let's go. So here, like you said, the patients in a hospital, it's not free,
Yes.
but they get at a very, very minimal cost.
Okay.
So it's at least 1/3 or 1/4 of the cost in any private hospital. Sometimes way lower cost. Sometimes in 1/10 of the cost. So if patient is very poor, we just write down. Say if a surgery cost 150,000 rupees, we normally can do it for 40,000 rupees. Okay, but even that, if patient says has no money, so we will just pay 25, whatever you have, you just pay and go. So we try to.
How about the spending?
So the spending, because the doctors are not working elsewhere, they only work here. So we work more than our 8 hours. So we are able to do more patients, more volume. So with a little profit here and there, we're able to run it.
Awesome.
That's the way this works. We have to somehow or the other help the patients, because the private is too expensive. It's been here for 160 years. So our primary thing is to help the patients by being accessible to them, affordable to them. And now, instead of being accessible and affordable, we are trying to add quality. Like, because we are affordable doesn't mean we should be low quality. Of course,
Yes.
within the resources that we have, we are doing all that. In fact, we are one of the few mission hospitals in the whole country to have the health accreditation. So our buildings may be old, but our systems are reasonably in place. It may not be like in the West or in Bangalore, but reasonably in good shape. Like we have come a long way since we were in 2010. We were just 4 doctors, the director.
And like most mission hospitals in India, our hospital also almost closed down in 2010 when we were just 4 doctors in the hospital, and there were no patients, and it was in a state of closing down. But by God's grace and with a team led by our medical superintendent, Dr. Anbu Suresh, and we were all able to work together and help in the revival of this hospital. So today, by God's grace, we have 60 doctors working in the hospital, and we have multiple departments. And my department, the craniofacial surgery and dentistry department, we have 7 doctors with 3 maxillofacial surgeons and 4 dental surgeons.
To have with us friends from Taiwan, Dr. Victor, and the team who's here to help us with some surgeries for children with cleft lip and palate. So we just went around and we did the rounds. We saw the patients in the wards and OPDs, and it's almost now 9 p.m. And tomorrow we have the first surgery at 6 a.m. So we'll be having 3 surgeries. Tomorrow we have a lip nose revision, cleft. We have a cleft palate revision to improve her speech. Then we have another orthognathic surgery to correct the facial profile, the jaws, and with some fat grafting. So we are so happy that we have our friends who's coming to help these children who will be benefited. And our goal is to help bridge all the gaps in cleft care so that they will be able to get back into the community as any normal child, not in any way being less than their peers, because often some of them, they get bullied for their speech, bullied for their appearance, and some of them don't like to go to school. My passion is that we bridge all these gaps in cleft care, from surgery to orthodontics to speech therapy, and all that is required so that they should not have this feeling, a negative feeling of why this has happened to me, and we want to see them rehabilitated into the society as a normal individual doing well. Yeah. So thank you and all of you for your support to Scudder Memorial Hospital and our patients with cleft lip and palate.
And thank you for staying for the society, even though you have many more opportunity in the big place. But thank you for staying here, and we'll try our best tomorrow.
Yes, thank you.
Thank you.
Yeah.
嗨，就是我们现在在那个距离清奈2个小时车程的一个城市，叫做 Ranipet， 然后的一家医院，这边的牙科 OPD 来协助教学他们这边的当地牙科医师，然后协助他们帮忙给他们点建议看病人。觉得在这2天呢，我来这边帮助他们呢，跟这边的牙科医师有很多的交流。然后也提供了很多我们的台湾的一些做法跟意见给他们，然后我觉得算帮助他们很多啦。然后当然我也是从他们身上也会学到一些东西啊，因为毕竟他们的物资上或者是器械上都会比较缺乏，所以我在他们身上也学到了说如何在一些比较不方便的情况下，如何可以快速的把病人处理好，能够用就最简单的材料、最简单的方式来去解决一些困难的 case。那我觉得，所以在教学这部分其实是互相是相长的。那我当然也带了很多我们一些台湾的一些牙科的一些新观念，尤其在假牙，我的传统的假牙怎么制作，植牙假牙怎么制作，甚至一些治疗计划、全口重建的治疗计划都有与他们分享。包括今天早上呢，我也是有帮他们上了一堂全口假牙课，因为我发现他们这边的 denture 就是假牙的病人量其实非常的多，但他们在做假牙这块呢，每个步骤上并不是这么的确实，所以我就有跟当地的医生安排说，今天早上来帮他们上一堂全口假牙的如何标准化的一个方式，然后我觉得也是受益良多啦，从他们身上或他们从我身上，就是很开心可以来这边来增广见闻，看看别人的牙科环境，然后可以分享我们所学，真的非常的开心。
Hi, I'm Dr. Osborne. I work at Scudder Memorial Hospital. I'm a senior dentist here, and we're very happy to have dentists visiting from Taiwan, Dr. Bruce and Dr. Victor. And we got to spend most of the days, 2 days, they were here, and we got to spend with Dr. Bruce. And we had a wonderful time with him, mainly of learning and understanding concepts and demonstrations of different procedures like impressions, crown preparations, jaw relation, and also complete denture protocols and a newer system, BPS system. So we are very glad that he was here so that we could open our eyes to understand and new concepts that we could incorporate in our practice, in our day-to-day practice. So we are very happy and very glad, and thank you so much for being here with us through these 2 days. And we hope that you'll be with us again soon. You'll be visiting us soon so that we can continue to grow and strengthen our dentistry. Thank you.
Hi, I'm Dr. Annie Evangeline. I'm an oral and maxillofacial surgeon and also a general dentist as such.
My name is Sherwin. I work in Scudder Memorial Hospital as a fellow in maxillofacial trauma. I finished my master's in maxillofacial surgery November of last year, and it's been 3 months since I've joined here for surgery. So yes, I'm quite new here, getting used to the place.
It's been a great experience with Dr. Victor, and I've learned many things about the surgical way of assisting. Basically, the way of assisting, I need to do it quickly, which I learned a lot. It's a learning experience for me, and holding the instruments and doing the suturing skills. Since I moved into general dentistry, now I'm back into surgery again. So it's a little difficult for me to cope up, but then I will take it as a challenge and do it. Next time when he's visiting, I'll be like a pro. And we'll do more number of surgeries and very quickly. That I can give you it's a challenge for me, but then I will make it happen. I'll put hard work and then we'll do it.
There are a lot of little phrases that he said which I have stored in my mind. The main one is, he said, this is plastic surgery, this is not maxillofacial surgery. maxillofacial surgery is different from plastic surgery, and I realized how tuned I was during maxillofacial surgery, doing everything with bone, and this is all soft tissue. Everything is so delicate, how we suction. And one thing is how he says, having the dream team, how everybody in the team works together. And I realized that we are not quite there yet. We are far from that.
Yes.
So, so yeah, I hope the next time he visits, he gave me a challenge as well. So I want to take him up on that challenge and hopefully, meet him there. Yeah, so looking forward to him visiting next time.
We'll do our best and we'll get trained ourselves and we'll train our sisters. And thank you so much for giving us instruments which we really appreciate, and it's an honor to get it from you. And we will make use of it in the upcoming cases. We will make use of it. And we'll never spoil it, that I can give you guarantee. We'll make sure we'll take care of all our instruments.
I hope that we can move step by step, and I think this place has a really good potential because you guys have such a good arm and all you need just instrument and all things, and we are helping, and the patient will flow in, and you guys will be good.
So we are happy in this state to be working along with a team of doctors from Taiwan. Dr. Victor, Dr. Bruce, and Ms. Delia and Annie, who've been very supportive, especially in our Cleft mission and also in other clinical work, in training our doctors, training our staff, and enabling us to expand the scope of services, especially in terms of cleft and craniofacial surgery. So they've been very helpful in giving us inputs and giving us other resources. And we hope, with collaboration from the team of doctors from Taiwan and also with Dr. William Choi, who initially initiated this project, and to be able to serve a much larger population, to refine the services, to close all the gaps in the services, to make it more comprehensive, to make it probably one of the best craniofacial centers in the country. God willing, since we are working not for our own profit or for our own glory, since we are working for the welfare of the people in need, I believe that God will make this happen with the different people supporting us, especially the team from Taiwan. I am so grateful to them for having come here. Thank you.